pass this over. Welcome to the Mental Health Action Partnership, everyone. I'm going to pass this over to Kathy Markland from WAFCA.
Good afternoon, everyone. Good to be with you. Thanks so much for joining us. Welcome to the Mental Health Action Partnership. The Mental Health Action Partnership, or MHAP, is a broad statewide coalition gathered to promote ongoing improvement across the mental health system in Wisconsin. As Sita said, I'm Kathy Markland. I'm with the Wisconsin Association of Family and Children's Agencies, or WAFCA. We try really hard here not to get hung up on the acronyms, but it gets so hard. So you call us out on it whenever you hear something that you don't know what it is we're talking about. I serve on the MHAP core group, and we're just grateful to have you all gathered with us for our summit here today. And we're really glad that we were able to pivot a little bit and make this available in a virtual format for folks this time around. By way of an icebreaker, I'm going to invite you all. I tend to be the designated queen of the icebreakers around here, but here's my question for you to drop in the chat. Please share in the chat either the place you were born, so if you're a Wisconsinite, city, town, in Wisconsin, or wherever you were born, or what place you consider your home community, whatever home is for you. So I think just drop that in the chat, and I'm curious to see where all people hail from. All right, I always think Belgium, Wisconsin sounds really exotic. We have a Kentucky, a lot of Milwaukee's. California. All right, that's interesting to learn. Very interesting. I actually know where Keeler, Wisconsin is. I know that. Jefferson City, Missouri. Nice, Missouri. Call out for that. Little couple Chicago. Good deal. Stoughton, Suring. I also know where that is. Not trying to toot my own horn. Okay. Toronto, Ontario, Canada. Never knew that about you, Miss Sita Deal. That's so interesting. Not that Appleton is not also interesting. It is. But something about Canada. Okay. Well, thank you all. Thanks for jumping on that quick icebreaker. Part of our hope here at MHAP is that we're creating relationship and community with you all. So that is how we're trying to make sure that we are getting to know each other beyond our maybe specific roles and how we step into this work together. So sharing up slides. I think we're moving on to. We're going to walk through the agenda in just a bit. Before we jump in, I'd like to get a sense of your involvement in MHAP. So that's what we're asking about. So we are going to be asking a little bit about whether or not this is your first MHAP meeting. And I know some of you have been with us since we launched back in October 2023. So Julia is going to post a quick poll for us asking that question about how you have come to attach to MHAP, whether this is your first time.
Okay. Hi, everyone. Can you see my screen?
We can. I see it right now.
Awesome. So I just put a link in the chat to the poll questions. If you'd rather do it on your phone, you can scan the QR code on the screen, or there's also a code that you can submit. So there are a lot of options here. And we can see the results coming in. We see a lot of folks so far who attended in Wausau last May. We've got a lot of folks who this is their first summit, which we're really excited to have you join us. Let's see, scrolling down, we've got some folks who've been here a long time and were at the first summit back in October of 2023, but awesome. I'll give it one more minute in case anyone's still putting in the responses, but it looks like for about half of us, this is your first summit. So we're super excited to have you here.
Yeah, and I would just invite folks, and now in the chat also, this is great. There's a few old timers among us here. I say that with love. interested in the chat also if people would be willing to share sort of what brought you to the meeting today. If it's first time or not first time for you, how did you learn about MHAP maybe, or what prompted you to want to be present here today with us?
And then we also have we have two more quick poll questions.
Oh, sorry, Julia. I got ahead of myself.
You're all good. So next one was just which work group or work groups have you participated in, or if you haven't participated in one yet. Awesome. We're seeing a lot of folks who've participated in the Medicaid work group. A lot of folks who haven't had the chance to participate in a work group yet, which makes sense because we saw a lot of folks here haven't come to a summit before. So it makes sense if this is your introduction to MHAP. Got 22% from criminal justice work group, some folks from the data work group, and workforce access and equity. And then the governance work group hasn't met in a while because they kind of meet as needed, but they did the really important work of deciding, how we were going to sort of run and structure MHAP. So shout out to them. Awesome. And then, so yeah, most folks haven't, or the biggest chunk is about a third of folks haven't participated in work group yet. Then we've got Medicaid. Thank you guys for answering. And this is the last question. So how did you first hear about MHAP? We're curious, what your first introduction to MHAP was and who, first let you know this was a thing you could be involved in. Awesome. Seeing a lot of folks say that they heard from someone at their organization about MHAP. A lot of folks also saying they were invited by someone who was already participating in MHAP. We have a few others. And then a couple of folks heard from a local coalition, which is cool. So we're still getting a couple of responses. So lots of folks invited by an existing MHAP member. Awesome. Well, thank you all for participating in our polls. This is something we haven't done before, so we're excited to kind of hear from you all about, kind of how you first got involved with MHAP and how long you've been involved. So now I'll pass it back to Kathy. Thank you.
That was cool, Julia. Thanks for doing the polls. That was super fun. That's a good way to get some of that feedback and engagement. I really appreciate that tool. We saw some people post in chat too about personal connections that help to pull them into connecting with MHAP and some specific things that people might be interested in about how we're helping in the Mental Health Action Partnership to advance some initiatives forward. So thank you for that. So our agenda today is simple. Sita will give you a brief overview of MHAP, but for most of the meeting, we are very pleased to welcome the Interagency Council on Mental Health, who would like to hear your thoughts on how to deliver mental health care in a more integrated way. Then, very exciting, Julia will introduce the new MHAP website, and we'll give an overview of our summer work and then close with a little celebration of the work we have done so far. We've come a long way and are looking forward to bringing more folks along on the journey we see ahead. So now I will turn it over to Sita for a brief overview of MHAP.
Thanks, Kathy. So MHAP is a broad, sustainable coalition gathered to advance equitable access and continuous improvement in integrated mental health care throughout the state. You can tell we hammered out each and every last word in that sentence. Our vision is that through the work of MHAP, every person in Wisconsin who wants or needs mental health care will be able to easily access quality, affordable care in their community. And Wisconsin will have a well-integrated, sustainable continuum of mental health services and supports that responds in a compassionate, timely, effective, culturally informed manner to any child, youth, or adult anywhere in the state. These are lofty goals, but the point is that we're in the big tent, we have long-range plans, and we want to work together across all sectors of the mental health community throughout the state. So our policy recommendations, we're working on 3 levels of recommendations. So these have actually been very useful because in the past, People tried to start with the big blocks, and there were frank disagreements on how to proceed. So far, we've been focusing on low-hanging fruit, and those are policies where everyone agrees that it would help, and that they have been discussed, and often they've been discussed with the administration and the legislature and the counties, and people who have the decision-making power in the state. So we have identified 12 proposals, 10 of them that required legislative action, and these are short-term proposals. That said, we wanted to get them across the finish line in this legislative session. There's a lot of environmental influences, I'm just going to say it that way, and it may take longer, but these are things where everyone agrees these things will move us forward. And now we're turning to medium-term priorities where everyone agrees that improvement is needed, but it's going to take study and planning and negotiation to do something that we all feel would work. And then we're also mindful that there are major needs in Wisconsin's mental health care delivery system. And as we develop those relationships and we have a lot of conversations and a lot of discussion and begin to see things from each other's perspective, maybe we will find a way forward. So MHAP is truly a partnership. Decisions are made by all of us working together, but the details are hammered out in the work groups. That's where the real work happens. At the summits, we bring the summits like this, we bring forward the work that the work groups have done, and we ask for your feedback, we ask for your input. But if you want to be part of the real work of MHAP, then join a work group. The ones we have right now are shown on the slide, but they will change over time as needs come and go, as needs shift, and as we need to focus on various things. There's a core group. I'm going to go, can you go back a little bit? Yeah. There's a core group currently with 9 dedicated people who meet at 8 a.m. every other Monday morning just to kind of move MHAP forward and to think about where are we going, where are we now, what are we doing, how can we be most effective. And then we also host virtual learning sessions in the months when we don't have a summit to kind of level up across the whole MHAP community. What do we need to know? What best practices should we be aware of? What issues should we dive into together so that we all have the same knowledge set in order to collaborate together on mental health policy advancement. I'll talk about membership, which is very open at this point. There are no requirements or fees. All we ask is that you want to help improve Wisconsin's mental health system and would like to collaborate in good faith with MHAP partners. We may be more formal over time, but right now the door is open. Everyone is welcome. And then we have developed principles of engagement. These help us work together productively. So boiled down to its most simple form, before speaking or writing, consider, is it true? Is it kind? And will it move us forward? And then in more detail, we will share understanding. We will share information and perspectives. Differences of opinion are an expected part of MHAP work, and we see them as opportunities to learn from each other. And we agree that from where we sit, we're each doing the best, what we think is best and fair. So we give each other credit and work in good faith. And when advocating for system change, consider why something exists and what is needed for improvement. And when we disagree, explore further. As we said before, these are learning opportunities. So don't just sit back where there are disagreements. Say, please tell me more about this. And then let's have a frank discussion. And as we seek shared understanding, we are confident that solutions will emerge. So those are our principles of engagement. And now I am very pleased to welcome Karen Odegaard, External Affairs Liaison from the Office of the Secretary of the Wisconsin Department of Health Services. Karen and her colleagues will tell us more about the Interagency Council on Mental Health and what they hope to learn from us during the listening session today. So Karen, over to you.
Thank you so much, Sita, and everyone for allowing us to join you today. As Sita said, we are really excited to talk with you all about the Interagency Council on Mental Health. And while we'll have a brief presentation, for the majority of our time, we're going to actually spend in small breakout groups to hear directly from you all. So just so everyone's prepared for conversation to come. So thank you so much for being here today and for allowing us to be with you. As Sita said, my name is Karen Odegaard. I'm the External Affairs Liaison in the Office of the Secretary at DHS, and I'm part of a small team at DHS who is helping to support the Interagency Council on Mental Health. And you'll hear from a few of us today, but I want to take a moment to thank my colleagues who are joining us today. Paul Krupski, Policy Director here at DHS, is going to be stepping in and helping with the presentation to get us started. But we also have Michelle Hayes, Lauren Reeves, Marlia Matke, all from DHS. And then we also have from the Department of Corrections, Dr. Melissa Parent joining us, and from the Wisconsin Department of Veterans Services, or Veterans Affairs, excuse me, Cal Stammer. And then special guest joining us from the UW Population Health Institute to help us out with note taking so we could have small groups today, Abra Vinya. So thank you so much to all of you. Those are the folks who will be leading our small group discussions. So we'll be you'll have a chance to get to meet some of them and get to talk with them a little bit more. So as we said, the purpose really is to hear from partners like all of you who bring a range of experiences with mental health, whether being folks with lived experiences, people who support loved ones with mental health, excuse me, mental health challenges, or providers, advocates. You all, especially at this table, really bring a robust set of experiences and expertise that we're very eager to hear about from you. Before we do dive into that, I want to take a few minutes to sort of level set with you all about the current state of mental health in Wisconsin. From there, we'll provide a brief overview on the Interagency Council on Mental Health, and then we'll jump into those discussions. So, as we said, this group is very knowledgeable about the current state of mental health, but just to sort of have a common starting point here, we have a few data points to share. We know that far too many Wisconsinites, especially youth, are struggling. 1 in 4 adults in Wisconsin report symptoms of anxiety or depression. And nearly 50% haven't been able to receive or haven't chosen to receive treatment. More than 10% of adults with mental illness are uninsured. The suicide rate among Wisconsin residents increased by 39% from 2000 to 2022. In 2022, 929 Wisconsin residents died by suicide, making suicide the 10th leading cause of death. It's estimated that one suicide death affects as many as 135 other individuals, including their family, friends, coworkers, professionals, and others who valued their life. This means that in 2022, over 125,000 Wisconsinites would have felt the unique loss and grief that accompanies suicide. This figure does not account for the additional numbers of individuals affected by a loved one living with suicidal ideation or prior suicide attempts. Our young people have been particularly affected by the mental health crisis. Within the last year, 59% of high school students report experiencing at least one mental health challenge. 19% seriously considered suicide, 15% made a plan to attempt suicide, and 9% attempted suicide. According to the 2023 Youth Risk Behavior Survey, Wisconsin students are struggling with anxiety, depression, and self-harm. Just 1 in 5 students who felt sad, empty, hopeless, angry, or anxious said that they received the help that they needed most of the time or always. But we know that when we can get kids connected to care, many find it helpful. 78% of youth reported that counseling has worked. So these are the data points that we use or we are thinking of as the foundation for the work that we are doing across agencies. And I'm going to ask Paul to step in here and talk a little bit more about the Interagency Council and where we are trying to go.
Great. Thank you. Thanks, Karen. So in order to improve and support mental health of all Wisconsinites, we all agree, and I'm sure all of you as well do too, that we need to take an all hands on deck approach to this solution. And so from the state government side, this is why Governor Evers created the Interagency Council on Mental Health. What the council does is it brings together state agencies from across the entire state with the goal of expanding access to mental health and substance use disorder services, increasing prevention efforts, reducing stigma, building capacity among caregivers and providers and other community partners to just overall address the mental health crisis as a whole. What he tasked the Interagency Council with doing is to create a statewide action plan. And what the council is focused on in building this action plan are 2 specific things. First, supporting Wisconsinites by creating healthy communities, and then also connecting Wisconsinites to care. And these are really the top priorities for the council right now. When Wisconsinites need mental health support for themselves or other, we all know that it's super important that they be able to get that care when they need it at that super important time. And no matter how they try and access it, which door they choose to go through, really trying to ensure that appropriate, timely, and affordable support to care across all government agencies and also partner settings. And obviously, we know that we can't do this alone. It takes all of us working together across the state to really address this crisis. And we need to hear directly from Wisconsinites who have been impacted, as well as all the providers that are offering these services. And that's why we're doing this listening session approach with all different groups. So again, thank you for having us here today. So as mentioned, we're taking a whole government approach to this work. As Karen mentioned, the Department of Health Services is serving as the lead agency for this effort. Secretary Johnson is the chair, but we are really grateful to have cabinet level appointees from all the other agencies that you see on this slide working alongside of us. I will note that when you see this on this slide, all the different state agencies, there are some that you probably recognize are missing. Again, this is cabinet level membership. So other agencies like the Department of Public Instruction, the Department of Natural Resources, the Office of Commissioner of Insurance. These are state agencies that we know obviously their work touches this space and mental health as a whole. And so our department here at DHS, our team that is supporting the Interagency Council on Mental Health has ensured that we're engaging those state agencies as well to get their thoughts and their input on the issue. Karen mentioned that we have some other representatives here today from other state agencies, so I want to give them the chance to say a couple words on the whole government approach and the Interagency Council as a whole. So I can first start with Dr. Parent from the Department of Corrections.
Thanks, Paul. I'll just say from the Department of correction standpoint, allowing all of these cabinet level agencies to come together has really reinforced the partnership that has already existed and allowed us to expand that partnership. Prior to the formation of the Interagency Council on Mental Health, we already had existing programs serving justice-involved clients with DHS, DWD, WDVA, and certainly it's allowed us to strengthen those partnerships and look at expanding those services. But it's also provided opportunities to engage with other agencies such as WIDA, right? We're currently welcoming WIDA into some consultation groups that we offer to really try to link justice-involved individuals who are coming out into the community, releasing from our institutions to housing, because we know that housing is a huge issue in Wisconsin, especially for our justice-involved population. So that's a bit of an update from the Department of Corrections.
Thank you, Dr. Parent. And then, as Karen mentioned, we also have Cal Stammer here, who represents the Department of Veterans Affairs. Cal, if you'd like to say a couple words.
Hey, thank you, Paul. I could probably just honestly say ditto to everything that Doctor just said, but I'll expand a little bit on that. I mean, it's really about these partnerships, and the agency as a whole, but I really think it breaks down to the people that do this job and the people that are boots on the ground in our communities as a state agency. I think the relationships that we've been able to foster and really at the ground level of kind of expanding our programs. I mean, we're unique, just like doctors, is unique as well within folks that are incarcerated. But, we have about 300,000 veterans in the state of Wisconsin. And a lot of those veterans, they work with all the other state agencies. So how can we work together as a state, I think is one of the biggest things that I've seen come from the first meeting to where we're at right now.
Thanks, Cal. Appreciate those words.
Yep.
So, from the council structure standpoint, how we've tried to kind of bucket the work that is doing is we formed two work groups to support the council, and this is where agency staff like Cal and like Dr. Parent, who you just heard from, this is where they are representing those departments at the work group level and doing a lot of the time consuming, really tough work to elevate to the council to assist their decision making on what the action plan will look like and what will be included on there. So the first work group that I'll focus on is the Strong Foundation work group. Now, this work group is really focused on how agencies can foster a culture and an environment that really promotes mental wellness. We obviously, and again, speaking to the choir here, we know the stronger that foundational elements are, the more protected people are when they're experiencing mental health challenges. So this work group is really thinking about those preventative measures as well as what we categorize as those social determinants of health, markers such as housing, such as childcare, and just social connectedness as a whole. And this is where we're also thinking about strategies to how do we raise awareness about the importance of mental health as a way to prevent mental health challenges from starting. The second work group that we stood up is what we're calling our coordinated response work group. And myself and my colleague Michelle Hayes, who is also on this call today and going to be helping out with the listening session, her and I co-chaired this work group. And in this work group, this is where we're really focused on that no wrong door approach. How do we get people affordable, accessible, timely care when they need it? So really, the agencies are looking forward to ensuring that a person or a loved one needs help, they get the care that they need, no matter what they need, no matter which door they go through. We're thinking about, as I mentioned, those timely, appropriate, affordable, and accessible services for mental health, and really, along with the no wrong door, what are strategies to create a sustainable workforce, as we know is just a challenge, no matter what area you work in nowadays, across our state and across our country, and really ensuring that trauma-informed care is offered in the variety of places that people access these services. So gonna hand it back over to Karen to move us into the discussion. But as we move into the discussion today, we'll be framing the discussion questions around these two buckets, the strong foundation bucket and also the coordinated response bucket. So if you can make a note and keep this in the back of your mind about the way that we are the way that each of these groups is focusing on the problem, that'll be helpful moving into the discussion. But we'll definitely remind everybody when we move into those breakout groups. Karen?
Thanks, Paul. One thing I just want to note is when we are thinking about that action plan that Paul talked about, we're really focused on sort of the unique space of what agencies can do. We are focused on the actions and the ways that we partner with one another across agencies, the way that we connect with our partners like you all, and the way that we serve our constituents. We are less focused on the legislative actions or changes that would require legislative actions or that would require budget initiatives. So we're really trying to focus in on what is it that we and the agency level can control. So just wanted to give you a sense of what kind of strategies we're planning to include in that action plan. For our discussion today, I think Julia is going to split us into some small Zoom room discussions. Excuse me. We'll have, I have like a little cough thing happening today, so you're going to be really lucky if you get to be in my group. But we will spend about 40 minutes in that discussion. We've got about 5 to 6 questions that we'll work through, and so we'll make sure that we have time for all of those. So we'll have facilitators and note takers trying to keep that conversation flowing. Yeah, I think those are my caveats and notes about the discussion. Before we slip into those other rooms, let me just check to see if anybody has any questions or comments about the overview that Paul and I have provided. Dr. Imler?
Well, first of all, thank you so much for coming in and inviting our input. One of the areas that you do have control over are infrastructure issues in terms of departmental capacity. So does that include things like access to data, integrating data?
Yeah, it's a good question. And it is one that we have heard come up in thinking about where are the opportunities for us to have data, make data more accessible across agencies or share data resources across agencies. Or, I think even within agencies, we sometimes see that to be a challenge. So yes, I think that is something that we have heard. And I know Dr. Imler is something that is near and dear to your heart and what you hope to see come out of these types of initiatives. So appreciate you raising that. Vita?
Yeah, I've got a question that may be better for later, but I'm just wondering what comes out of this initiative, what comes next, and maybe just a little sketch of what comes next before we go into the work groups, because that would influence what I say.
Sure, yeah. So I do have a slide on this that we'll share later, but I'll go ahead and share it now as well. We'll be taking this back, and so we have been over the last several weeks engaging with a variety of groups, and in fact, some of you have already been involved in some of these conversations. So thank you for still showing up today. And we've done a few in-person listening sessions around the state. So we're taking all of this information back. We're very lucky to have an analyst on our team who is going to take all of this qualitative data and put together a set of themes that will be coming out of all of the input that we have received, so that we can use that to inform that action plan, which will be coming out. We'll be sending that to the governor's office by the end of 2025. The other way that I want to just emphasize that we'll be using this is there are a number of things that I feel like we have heard just even in the time that we've been doing this without the analysis that we can share with our colleagues in our agencies and let them know that this is input or feedback that we've received. So my hope is that we will start to see this input being used internally at DHS and in other agencies just by like there's so much value, I think, to our work group members and our council members to hear these conversations that I feel like they will, we are trying to find ways to plug it in, whether it goes in the action plan or it ends up somewhere else. This is all has been very valuable and rich, and I think will improve the work that we're able to do with one another across agencies and certainly to serve Wisconsinites across the state. Thanks, Sita. Okay, any other questions? Okay. Julia, should we just wait for you to push the button?
Yep, I can open them right now.
Okay, great.
So everyone should be getting an invitation to join breakout rooms. And I'm here if anyone has questions. I'm here in the main room.
Welcome back, everyone. I think I can't quite tell if everyone is back or if folks are still moving.
Everyone should be back from the breakout rooms.
Julia, I had just 2 more quick slides. Do we have time? Is that okay? Okay.
Yeah, I go for it.
Great. I wanted to thank you all. I know in my group, we had some very interesting conversation and really appreciate folks' insights. Sita had asked earlier about, what comes next. I'm going to talk about that a little bit. And I'm also going to point you to where you can share more information, because if your small group was like ours, you may not have had time to get through everything. And I don't know if I'm now showing you the wrong thing. Do you still see the right thing, or are you seeing my notes?
We see the slides.
Okay, lovely. Good.
Good, Karen. You're good.
Thanks. Otherwise, we can all read along. So I wanted to share just a little bit about some of the outreach that we have done and a little bit about what we have heard today, what we have heard so far, which mirrors some of what I heard today, at least in my small group. So we have a few ways that we are engaging folks in helping to inform the Interagency Council on Mental Health and the action plan that we are putting together. We have a public survey that thus far has received more than 1,100 responses. So that's what I'm going to point folks to. If you didn't get to say everything that you wanted to say today, or you come up with additional thoughts that you think would be important for us to hear, please share those in that survey, which will be open until June 30th. And I'll share a link to that in a little bit. We've done a number of partner meetings, and I know we've bumped into some of you in those spaces. This could be the Children Come First Advisory Council. We participated in a homelessness forum earlier this week. We've been to a variety of other boards and council spaces, so been really fortunate to have folks welcome us into those different settings. We also were able to do a very large listening session during the Opioid Stimulants and Trauma Summit in the Wisconsin Dells, where we had more than 200 people across a huge ballroom engaging in a conversation or in small group conversations on this topic. And then the regional listening sessions that we've been holding across the state. which we've done 3 so far. We've had nearly 100 participants total. We've got 2 more to go. And I wanted to share just some of the themes that we have started to see come out of all of those places of input. We know that mental health, both thinking about the foundation, having that strong foundation and a coordinated response is really complex and it's very interconnected. One of the quotes that stood out to me, and it feels like it was resonating as I was listening to people talk today in my small group, is be more proactive and less reactive. Families often have multiple needs across systems, and the help they can be given depends on the funding source and what their primary issue is. And so this idea of, I just heard somebody say, being a little bit ping-ponged between systems is something that we are hearing, and that they don't, folks aren't necessarily feeling like they or their families are being met with them in the center, right? It is whatever a funding source or whatever diagnosis is at the center, and then they're getting ping pong to other places. So that's one theme that we are certainly hearing. We also have heard about the administrative barriers that might exist within state agencies or across state agencies, and where are there opportunities to remove those barriers. The other thing that we've heard in a variety of ways is this concept of fail first, or that you can't get the help you need until you're in crisis, whether it is because there's a very long waiting list or there are all of these requirements to be able to access services. And so that is a theme that I feel like we've heard in a variety of ways. And then because we've been fortunate to engage with some specific identity groups, whether it was farmers or I had an opportunity to connect with the deaf and hard of hearing community, hearing about some of their unique challenges, whether it was stigma, which is certainly a challenge for the farmer community, or access to quality care, which is one of the things that we heard about from the deaf and hard of hearing community, and just some of the unique needs that go along with that. Those groups has been another piece that we've heard in these listening sessions. So let me pause and see if any of my colleagues, I'm thinking Paul or Michelle, I know that you've been in a lot of these sessions, if there's anything else that has stood out to you that you would name here.
I think, Karen, one thing I'll just add, it came up in my breakout session here as well too, is that appreciate people recognizing that if nothing else, this interagency council on mental health is a good first step. And let's not have it stop here. Let's have this lead to more communication, more coordination between all the state agencies, with a ongoing and showing a committed effort to increase and improve mental health around the state of Wisconsin. And so, Governor Evers has clearly been very supportive of this. This is a continuation onto the year of mental health from several years ago, not wanting to have that be a one-time thing. So appreciate people saying that. And again, we recognize that, which is part of the reason why this is happening in the first place, and we'll definitely advocate for the work to go on in some form or fashion.
Thanks, Paul.
Yep. And from my end, I think the resonating theme that I keep hearing even in today is that, everyone has mental wellness. Everyone has mental health, and where they are, right? That's what we're really talking about on that mental health journey. And at the end of the day, it's about human beings. So whether we're talking about across the continuum of care of services that are being provided, or the lack thereof, or the barriers, it's humans interacting with humans. And simplifying processes and ensuring collaboration can make all of the difference, because someone could be going through a really difficult time, or a caregiver could be reaching out to ask about resources or services, and they also may need support. And the person on the other end, the staff, the agencies themselves, the partners, they also would benefit from support as well. The better we take care of ourselves, the better we can take care of others. And there's that whole theme that comes back to humans relating and interacting with humans. That's what this is really all about.
Michelle, that came up at ours too. I'm Marlene Mackey and facilitated one of the groups as well. And that came up, the idea of supporting everyone in the process, and that the people that are out in the ground supporting our community members also need the training and support to really provide a stable foundation for wellness for everyone. The other comment that I thought was really helpful in our group was around the idea of, we talked a lot about how being inclusive is so helpful, bringing in voices that have lived experience and are out there doing things from the very beginning of projects, from the very beginning of changes or work products, is so important. And one of the members of our group pointed out that by nature, we are modeling this right now by doing these meetings and trying to continue to carry that on in that inclusive way in this process was really appreciated.
Thanks, everyone. We talked a little bit earlier about how we'll be using this. Dr. Imler, I see your note here about the Behavioral Health Gaps Report from 2019. I know that our colleagues in the Division of Care and Treatment Services are working on a revised or an updated gaps report, and so all of the information that we're gathering will be shared with them and vice versa, so that we are really using this information to inform in as many spaces as we can. This is the link, and you can use the QR code if you have additional thoughts that you'd like to share with us. We welcome those. And again, that survey will be open until June 30th. And we have gone over our time, Julia. Thank you for the grace and a little extra minutes, and really appreciate all of you for sharing your expertise and your experience with us today.
Thanks so much, everyone. We really appreciate you coming, and we really appreciate the Interagency Council on Mental Health. And now we're going to turn it over to Julia to walk you through our brand new website. Woohoo!
Woohoo! Hello, everyone. So I am really excited to share the brand new MHAP website with you. This is something we are really, really excited about. It's something we've been wanting to do for a long time. I also want to say thank you to Johnson & Johnson for the grant that we received to help create this website for MHAP. So our goal with this is just to make it easier for people to find information about MHAP, make it easier for all of you to know when the next learning session is, when the next summit is, finding documents like our sign-on letters or the Google Drive. So we're really excited about this. And like I said, thank you so much to Johnson & Johnson. We've got Debbie Bandy here from J&J. And so after I run through the website, I'll ask her to just say a couple of quick words. Okay, so here we are on the homepage of the website. The URL is mhapwi.org. And you're all welcome to explore this on your own, but I'll just run through what we have on here really quickly. So like I said, here's the homepage. We've got our, kind of explanation of what is MHAP here, and then information about our vision and information on how to get connected and get involved. We've got the About MHAP page here that talks about, what are our goals, what are our values, what was the formation of MHAP like? How did we start this coalition? And, when did it start? What was the background on why we decided to start this? Information on the structure, again, our objectives and goals, and then our values. We've got our current policy proposals page. So again, goal here is making it easier for people to find our materials as well. So we've got links here to all of the sign-on letters about the near-term proposals that we developed over the last, year and a half. We've also got a link to the summary of all of the proposals for legislative action that we've developed together so far. And then there's just a link to the folder of where you can find the full list of the proposals as well. Plus, we've got some information about how we went about developing all of these together and what that work looked like. Next up, we've got our partners page. So this is the list of people and organizations who had signed on to that MHAP overview document that we had circulating this spring. So we've got all the organizations listed, and we've got links to all of them here as well. And then all the individuals who had signed on as MHAP participants as well. And if you are not on either of those lists and you would like to be, please just email me and I will be totally happy to add you. Next, we've got our sponsors page. Again, shout out to Johnson & Johnson. Thank you so much for the funding that made this website possible. And just thank you to all the sponsors that have supported MHAP along the way so far. Next, we've got our Get Involved tab. So we've got a page here with information about each of our work groups and kind of what their focus is and what their goals are. We've got a page about our learning sessions. So this will be a really easy place for anyone to go and find the recordings from our learning sessions. So this is an exciting page, and I think we're going to reorganize it as well a little bit to make it a little more user-friendly and highlight all the different topics that we've touched so far in our learning sessions. An events page, this doesn't look like much right now, but we're in the process of planning our September summit, so there will be more information added here soon. I will still be sending out emails with invitations like I always have, but you'll still always be able to come to this page on the website and see what the upcoming MHAP events are. Next, we've got a subscribe page. So again, making it easy for folks to join the general MHAP email list from here. And next, a page just about our membership. Like Sita was saying earlier, there aren't really any requirements at this point besides just wanting to be involved in a good faith effort to improve the mental health system in Wisconsin. This page also links to the governance work group report that they developed last summer or last spring that kind of talks about what the structure of MHAP is like and how we make decisions together. Next up, we've got our contact page. So again, folks who want to contact us can do that here. We're really excited that we have a new MHAP email address that is easy for people to, remember and reach out to. So if you're ever reaching out, you're always absolutely welcome to reach out to me at my email address that, you would have gotten the invitation for this summit from, but you are also absolutely welcome to reach out to the info@mhapwi.org email address. And then the last page that I want to share with you is our member portal. So what this page has, it's password protected because it links to all of our Google Drive folders. So, we just want to make sure that no one who's not involved in MHAP can access it and maybe try to mess with our documents. We have to be safe on the internet. So this page just has information about who the facilitator is for each work group, what the current meeting schedule is for each work group, and then again, a link to each work group's Google Drive folder. And the way that folks will receive the password for this page is that if you're involved in a work group, your work group facilitator is going to be reaching out and telling you all what the password is. So that's how you would access it there. I know I ran through this really fast, but like I said, this is launched and ready to be used and ready to be seen. So you're always welcome to explore it more on your own. And, just let me know if there is, if you have any feedback or anything like that. I want to make sure that this website is useful for folks. So just let me know. And I'm going to hand it over to Debbie Bandy from Johnson & Johnson to give a couple quick comments.
Hello, everyone, and my apologies. I'm not able to be on camera. I'm in a public place, and of course, there's construction going on. It's stopped right now, so if you hear a loud noise, it's because they're drilling again. So my apologies for that. So, very, very brief. Here's what I want to say: is I want to say thank you to each and every one of you for all that you do every single day on behalf of those people who have mental illness, who have brain disease. I've been doing this work in public policy, gosh, just for about the past 14, 15 years. And, because of work of, organizations like NAMI Wisconsin, shout out. You guys do phenomenal work. I work across several states, so I see a lot of different organizations, and NAMI Wisconsin is one of the best, if not the best. But all the work that you have done, it is improving the lives of those who have, severe mental illness and mental illness of any kind. So, we know there's still more work to do. There's still stigma. There's still stigma, as someone said earlier, in different pockets of our society, such as farmers, such as Black men, and many others that, that we all know about. You all know probably more so than I do. So that's what I wanted to say, is just thank you to each and every one of you. And I will turn it back over to whomever is taking it from here, if it's Sita or Shulia. Thank you all.
Thank you so much. Thank you for being here. And again, thank you so much for helping us make that website possible. And I'll pass it back to Sita. Thank you.
Thanks, Deb. Really appreciate it. Thanks to J&J. So now we're going to take a little bit of a look at our summer work. MHAP is about action. And so we're going to look at our summer goals, and maybe, oh yeah, great. Here comes the slide. Okay. We're going to meet in Madison in September, early September. We don't quite have the date nailed down, but it'll be right close to the square. And the idea behind this is that we're going to start looking at medium-term goals. Remember how I talked about the low-hanging fruit and the medium-term goals? We're going to start turning to medium-term goals. It'll be probably a 3-hour meeting, so that those of you who want to go across the street and visit with your legislators, maybe in local delegations, will have the opportunity to do so. So, as usual, we will have small tables, so we'll present what the work groups have worked on between now and September to identify things that we realize we need to do in order to improve mental health service delivery throughout Wisconsin. That will take some study, that will take some negotiation, that will take some planning. Those are our medium-term goals. And the question in my mind, and should be in all of our minds, is we want to make sure that we can capture the opportunity as the legislature convenes in January of 2027. So we know there's a lot of wind blowing right now, but this too shall pass. So we have to keep our eyes on the prize. We have to keep preparing our ask so that when the opportunity arises, we can just go ahead and do it. And I told a story earlier where the mental health community had gotten together and identified some priorities. And after that tragic shooting, that horrific shooting at Sandy Hook Elementary School, the governor then said, okay, what can we do about mental health? And the Mental Health Coalition was prepared with about 10 proposals. So this is what we want. We want to have proposals prepared so that when the opportunity arises, we can put them on the table. So in order to do that, we need the work groups to have something ready to share with state agencies like our partners from the Department of Health Services or Department of Corrections or Department of Public Instruction. We need to have those proposals ready by May of 2026 so they can be incorporated into the governor's proposed budget for 2027 and 2029. And then we can advocate for them throughout the biennium with whoever we need to advocate with at the state, at the county level, or whoever. That's the way to kind of move the dial forward. I realize that uncertainty is the word of the day, but we need to keep our eyes on the far horizon because this too shall pass and the opportunities will arise. So we need to be ready. So possible, just some examples of medium-term priorities are making it less complex to bill Medicaid. I heard about that in my small group, or laying the foundation for Medicaid provider increases, or a study to establish a framework for mental health system redesign. In Wisconsin, we have a very complex system, and that means that it's not user-friendly, and a lot of effort gets spent on administration that could be spent on service delivery. Reforming the emergency detention process under Chapter 51 is one that the Criminal Justice Work Group is working on. Integrating data systems so that we know who needs to be served, who is being served, what services are being provided, and the quality and outcomes of those services. The data work group is working on that. And then strategies to strengthen the mental health workforce and diversify the mental health workforce over the long term. So those are just some examples, but you all very well may have other ideas. And I've heard some other ideas in the work groups today, in the small groups today. So please bring them forward. So please share your ideas in the online evaluation that we will put up. Julia will put the link in the chat, and then you'll receive it in an email right after the work group today, or after the summit today. And we will take those into consideration in the work groups. If a new work group needs to be formed, we will take that to the core group and work on starting a new work group and or refocusing one of the work groups that we already have. So now I'm going to turn it over to Kathy to talk about the status of the near-term priorities that we have already developed that we worked on since January of 2024. Go ahead, Kathy.
Thank you, Sita. So this is mental health action. Action is in our name. We are identifying items to work on together, and we've moved forward on getting some priorities moving in the process, and some things that are, we have some updates about things that maybe are hitting a little bump in the road, but that's part of the policymaking process as we put the things out there, and we know that sometimes it may be a longer road than we were hoping for things to move forward. So just wanted to share with you all that we have a kind of a bucket of things that are in process and a bucket of things that are still moving forward through various channels. So starting out with CSP, and I promised earlier that we would interpret all acronyms for all people here on the call. So the Community Support Program, state funding for the non-federal share of Medicaid for the Community Support Program, or CSP, it was removed from consideration by the Joint Finance Committee. So you may recall that the governor included full funding for CSP within his budget proposal. Joint Finance is currently working on the state budget, and they did extract a number of items from the governor's proposal. And so CSP was one of the items that they extracted from the budget. And so it's not on the table at this point for getting to full funding for CSP in this biennial budget. The second item that's on our list the first item that's on our list was community health workers, or CHWs. This is another item that was also removed from the governor's budget, and it was provided for full funding for the community health workers. Expansion of, among the other items that were removed from the governor's budget, expansion of the state healthcare provider loan assistant program. That was something that emerged from our workforce work group. And then also peer support Medicaid reimbursement, that was also removed from the budget. So those are some elements that have are kind of, we were considering them in process in the sense that they can come back as individual proposals, perhaps legislation yet this session, although it can be challenging to get funding items considered outside of the budget process. But we do have good draft language now about what it would entail to adopt these things. So because they were incorporated in the governor's budget, we have statutory language and funding language that is available for us to see introduced as separate legislation, or to come back to and revisit in the next biennium. In addition, just an update on dialectical behavioral therapy. So there's been a good group that's been working on DBT, and they are working on legislative language and currently seeking champions and sponsors and authors in the state legislature to move forward with a DBT, kind of a bundled benefit for DBT within the Medicaid program. In terms of other items that are moving forward, we just wanted to note it for you all that we have a couple other proposals that have moved forward in bill format. So the Clubhouse grant bill has been introduced. So this would provide for some grants, some funding grants directly to the clubhouses around the state. and some core dollars to help to support their operations. Also, treatment alternatives and diversion. So that's our TAD expansion bills. Those would allow for to increase the ability of some of our justice system responses to be more conducive to individuals who have treatment needs within our systems. These bills specifically would expand beyond substance use treatment to also include those with mental health conditions under the definition of for treatment alternatives within our TAD programming. Psychiatric Residential Treatment Facility Bill, so PRTF. These bills have been introduced in both the Assembly and the Senate. Both of the bills have moved out of their respective committees in both houses. And Psychiatric Residential Treatment Facility is on the floor of the Senate today. And so we're anticipating approval of that bill in the state Senate so that it'll just have one more hoop to jump through over in the Assembly, which is exciting to see that progressing forward after a lot of groundwork that was laid in prior sessions to get us to this point. That's how the process works. And sometimes it takes multiple sessions. And so it's good to see things finally catching fire and moving forward as we talk about them. And then finally, just want to reference qualified treatment trainees. So that's your QTT item on this slide. Qualified treatment trainees are individuals who are licensed mental health professionals who are still pursuing their 3,000 hours. So they're in training and they're in an in training status with their licensure, but moving forward with their 3,000 hours of supervision time, clinical supervision in order to achieve full licensure. So the QTT grant program is something that our groups have supported as well, and that is continuing to be considered by the Joint Finance Committee, and we expect them to take that topic up with the DHS budget as early as next week. That will be under consideration by Joint Finance for approval. And Sita very helpfully translated everything in the chat for us. So any quick questions about any of those items? If not, and please use the chat, that's welcome to. We're going to move right on to Dr. Michelle Broadus from the Medical College of Wisconsin, and she's going to talk about our local coalition project funded by Advancing a Healthier Wisconsin Endowment.
Kathy, I am mindful of time, so I am going to go through this pretty quickly. There will be more information to come, but just to let you all know, thank you to those who have participated in surveys and discussions with MHAP core members about their local coalitions. A lot of great work happens at the state level, but it's really those local coalitions that can get shit done. So more to come, but we were interested in engaging local coalitions and seeing sort of what the common strengths, challenges, and opportunities there were. Overall, people are relatively satisfied with their local coalition, especially in terms of caring about the future of the coalition, but maybe some room for improvement in terms of communication between local coalitions and their local communities. Overwhelmingly, we hear that the strength is in you all, is in the people, everyone coming together. And doing that in coalition spaces comes with both challenges and opportunities. And this won't be any surprise to anyone on this call who are also juggling other responsibilities, just the lack of time to get together and staffing and financial resources that are scarce. Often leading to, maybe a core group of people that do a lot of the work, and that can be frustrating for those folks. It leads to sort of a imbalance in the burdens of coalition-based work. But when people come together in coalitions, there's a lot of opportunities to be creative, to find linkages that are maybe non-traditional, to be more inclusive, think about equity, think about who's at the table and who's not, how to hold different sectors within a coalition accountable to each other and to the community, getting recognition and engagement from stakeholders, from media, and being able to provide a lot of the trainings that have been so well received by communities. For example, CIT, acronym not, which is the Community Intervention Training for Law Enforcement. I might have got that acronym wrong. So again, I want to be mindful of time because I want to get. Thank you. Crisis intervention training. Thanks, Sita.
Terrific. Thank you, Michelle, for giving us an update, and thank you to Advancing a Healthier Wisconsin Endowment, which has supported some of our summits. And I'm now going to discuss some celebrations for our uh, partnership. Thank you, everyone. And now that I'd like to take this moment and shout out our accomplishments. MHAP has had goals of many of us, and we were so excited to gather so many people together. Personally and professionally, it is to improve the mental health system. We sometimes get frustrated as we move forward because it's a lot of work and it's a very slow process. But we feel it's always important to celebrate our wins. So I'm just going to highlight some of those wins now. We have had gathered for 6 summits, 3 in person and 3 virtually. We have had work groups meeting. We have 6 work groups, and they have had 49 work group meetings virtually over this time period. And this has been a 20-month process that we've been doing this. The work group cranked out 12 near-term proposals. Kathy went over 10 of them that we were able to put forth. We were also able to host 10 virtual learning sessions, and those are recorded and now up on our new website. So if any of you missed them, you can go to our website and see the new recordings. Not new recordings, but the recordings. We have now wrapped up one local coalition project that Michelle just reviewed for us. And we have launched a new website that details all of the things we've done, connects us together, gives us a place for us to go and share people and tell them about MHAP. And we're just really delighted about this opportunity to celebrate our wins. And best of all, through all of this, we have stronger working relationships throughout the state. We were just talking earlier today how by connecting with folks, we've been able to respond to some of the chaos that's going on right now in the state by having these relationships we've built and being able to respond to some of the chaos and go, oh, I know this person. I met them at MHAP, right? And just quickly gather. And that's, a huge part of coalition building and partnerships is to be able to meet and understand people, know where they're coming from, and be able to gather in a short and quick responsive way. So I really appreciate all of this celebration that we have throughout the state and all the work that's gone on to bring this together. And I just want to thank all of you for participating in MHAP events and engaging in the work groups. But I also would like to really recognize at this moment the hard work of Sita Deal, our NAMI Wisconsin Public Policy and Advocacy Director, who has dedicated a lot of her time to get this partnership going. I do want to take a moment to acknowledge that while Sita will continue to be a part of MHAP, she's going to try this whole thing called retirement again. She didn't do it very well the first time, and she's going to see if she can successfully do this a second time. So Sita, would you like to just say a couple of words?
Sure, I'd love to. This has been a total privilege. MHAP is why I came out of retirement, to help bring the mental health community together, because I've seen so much excellent work around the state, and we all need to be aware of what each of us are doing in our own little corners and our own little communities, and then scale it up and knit it together. So I'm really excited about the Interagency Council on Mental Health, because building bridges and integrating things and working across domains and across populations and listening to each other, I think is the key to our long-term success. So it's been an absolute privilege to serve MHAP. As Mary Kay said, I'm rotten at employment, at retirement. So I'm going to continue volunteering. So I will continue working in the work groups, but I'm not going to be doing a lot of the duck paddling underneath the water kind of stuff that has been necessary. And I have to acknowledge my partner, Julia, in this, who is going to continue paddling. And I know how much work goes into making all of this stuff happen. So thank you, everybody. And I'll continue to see you in the work groups and the summits.
Thank you, Sita. And I just want to please remind everyone to complete the meeting evaluation, because that evaluation just doesn't help us how we did. We have a item in there that we are gathering your ideas for the next many months of where we do that next layer. It's a really important evaluation. That's the most vital part of this coalition, of this partnership, is to get everyone's input. So please, please, please fill out that survey for us, and also give your insight. Visit our new website, look at the learning sessions. And as Julia said, we have created a email called info@mhapwi.org that gets it where it needs to go. So please use that and share that one as well. And if you would like to, one of the things with Sita's upcoming departure is we want to really emphasize the real work in this partnership and this coalition happens in our work groups. And we are needing participation. We are needing some leadership. We're needing experts in those areas. Please consider joining our work groups, and we do need some co-leaders in those work groups. So please contact us. We would love to have more participation there, because that's where we feel like most of the real work, the coalition work, is occurring. So please reach out to us, join us at our work groups, email info@mhapwi.org, and let us know that you want to join our work groups, and we will see you in September. Date to be announced soon. Thank you, everyone.